Like and subscribe for daily OT brain boosters. An OTR evaluates a 6-year-old child with developmental delays using a developmental frame of reference. Which statement would best support intervention planning within this approach? A. The child demonstrates skills similar to those of a typically developing child who is 3 to 4 years old. Context. This answer directly reflects developmental comparison, which is central to the developmental frame of reference. An OTR is evaluating a kindergarten student who becomes distressed during loud group activities, avoids messy art materials, and has difficulty staying regulated during transitions. Therapist is using a sensory integration frame of reference. Which information is most important to include in the evaluation? B. The child's responses to sensory input and the effect on participation in daily activities. Context. Sensory integration frame of reference looks at how the child processes and responds to sensory input and how that affects function and participation. An OTR is evaluating a teenager with depression who has stopped doing schoolwork, social activities, and hobbies. The therapist is using the model of human occupation. Which information is most important to include in the evaluation? A. The teen's volition, habits, roles, and the effect of the environment on participation. An OTR is evaluating a 4-year-old child with global developmental delays. The therapist is using a developmental frame of reference to guide the evaluation. Which information is most important to include in the report? A. The child's skills compared to those expected of a typically developing 4-year-old. An OTR is evaluating an adult with chronic schizophrenia in a community living program. The therapist is using the cognitive disabilities frame of reference. Which information is most important to include in the evaluation report? A. Identification of the client's cognitive level based on performance in routine tasks. Context. Cognitive disabilities frame of reference focuses on identifying the person's cognitive level and determining the types of tasks and supports that match that level. An OTR is treating a client after a distal radius fracture and is using a biomechanical frame of reference. Which information is most important to document? B. The client's ROM, strength, edema, and endurance during functional activity. Like, comment, and share. Learned something or nailed it? Follow us to stay OT sharp. You got this.